record and starting the webinar. Hello, everyone. Welcome to those joining us. It is 9 o'clock. I will give you about a minute to get settled, get your audio set up. Okay, it is 9:01, so I'd like to get started. Good morning and welcome. Thanks for joining the Prenatal to 3 Policy Forum today. In order to maximize bandwidth and viewing optimization, microphones and cameras are off for all attendees. For any questions, please input them into the Q&A chat panel found at the bottom of your Zoom screen. Questions will be moderated by Jane and her team and addressed at the time of Q&A session. Before we begin, I do need to disclose that this session is being recorded. At this time, I invite Dean Michael Hang, Vice President of Strategic Initiatives and Founding Dean of the Morrison Family College of Health at the University of St. Thomas, to start us off.
Thank you, Hayana. Good morning. I'm Michael Hang, Founding Dean for the Morrison Family College of Health. The college was created in November of 2019 to address the social determinants of health. Well, what does that mean? It means that we're working to educate our students about the 80% of what creates and actually produces good health in the community outside of hospital and clinic walls, and also, of course, a training and educating students to address what actually can happen inside of a primary care, acute care setting. So the social determinants of health are really important to us, and they include factors like race, poverty, and also place, geography. That's not all that it is, but much of it can be attributed to these 3 factors. So we don't believe that an individual who starts out life will have their lifespan shortened because of where they live and who they are. For many years now, St. Thomas has co-hosted and been a partner to the Prenatal to 3 Policy Forum. And I'd really like to welcome you and thank you for your interest, engagement, and more importantly, past and future actions to help us ensure that every child in Minnesota receives the best start in the first 1,000 days. The evidence has continued to build around these first 1,000 days so we can prevent learning gaps before they start. And as well, because we are human beings, we also need social and emotional investments so that from an early age, we can prevent trauma, heal from it, and give children what they need so that they can be healthy across their lives. To do our part with educating the broader community about the importance of our collective efforts to affect change and invest in the prenatal to 3 ages, we're also part of the ITASCA project at the University of St. Thomas, specifically the First 1,000 Days project, and also launched the Minnesota Trauma Informed Educational Institute at St. Thomas last year. So please continue to join us and to lift up this work for our youngest Minnesotans. And now I'll turn it over to our wonderful next presenter and presenters that you'll be hearing from.
Thank you, Dean Hang. I'm Jane Kressman. I am one of the elders for infants, and I want to thank the University of St. Thomas for their generosity, and also thank Representative Lisa Damath and Representative Dave Pinto, who are our legislative bipartisan co-sponsors for the forum. As you recall, the policy forums have 3 goals: to share plans, to build knowledge, and to build relationships. And sadly, over the last 2 years with the pandemic, we've been unable to meet in person. And we are wanting to do this morning a very brief poll of audience. And I'm going to have us advance the slide, and also Hayana Yang will put up the 3 poll questions that we have. And this is really for us to learn who's in the room since we can't see you. And the first question involves, where do you live? That's fairly simple, Metro and Greater Minnesota. The second one asks you to describe your primary affiliation and it professionally and otherwise. And then the last question invites you to give us your opinion about what particular goal from the forum do you especially appreciate or find most helpful and important. So we're just going to take a few minutes to have you complete that poll and then just hit submit. And that's going to give us a good snapshot. We have 290 registrants for today, which is marvelous. And we are so grateful for all of you to be with us. We've also added 15 minutes to our usual 90-minute virtual format. We want to allow extra time for questions and answers. And as Hyana Yang mentioned at the beginning, we'll use the Q&A function, not the chat, and we'll be monitoring the questions. So at this moment, I think we're going to close the poll. We'll give it, that's good. And I'm going to welcome our first speaker to the virtual podium. This is Jeff Bauer. We're so grateful you are here. You are the Executive Director of the American Academy of Pediatrics for the Minnesota chapter. And Jeff is going to provide us an overview of the policy and budget context that we are in today. So with that, Jeff, welcome and thank you.
Well, thanks so much for that introduction, Jane. I'm so happy to be here today with you all. You know, I was so excited to be invited. This is really full circle for me. I was, back when I was doing policy work for the Family Partnership for so many years, I remember very specifically remember having a cup of coffee with you, Jane, I don't even know how many years ago now, and Representative Pinto trying to dream up this whole prenatal to 3 policy forum idea. So it's just amazing to be back. So we can jump right in. So next slide, please. So that's the full circle for me, bullet point. So a little bit about the Minnesota chapter of the Academy of Pediatrics, and just a minute on kind of our history with this issue. For the last several years, we've had an early childhood caucus doing this work. I'm sure many of you are familiar with Dr. Krish Subramanian and Nate Chomolo doing this work. And I also really want to call out an amazing group of retired pediatrician early childhood advocates who, so Dr. Sheldon, Mellon, Dobrin, Alden, and also Dr. Tom Scott, who really have been advocating for the chapter to step up and do more and be more public and be more engaged in this. I really want to credit that group for pushing us to move this up on our priority list at the chapter. So just last week at our January board meeting, the chapter board of directors approved early childhood as both a strategic priority for the next 3 years for us, and also a top legislative priority for the upcoming legislative session. And so what that means organizationally for us is that it goes from being a caucus to a work group. And what that means in our structure is that it now has staff support. We have a lot more capacity to engage in these issues. So that's really exciting. We're also excited because, I think the pediatric community really has a unique voice in this. I think, pediatricians remain highly trusted people throughout every community in Minnesota to speak on these issues and carry a lot of credibility. And I know in our previous testimony and in previous sessions, that's really been the case. And finally, just want to mention National AAP also has a whole trove of resources about early childhood issues. So if you're ever working on anything, feel free to reach out to me. We probably have some great background research from National AAP if that's ever something you need. All right, so very brief legislative session overview. This is going to be 101 for a lot of you, but it does help to frame this all up for all of us together. So just a reminder, this is a non-budget year, so there is no constitutional mandate for the legislature to pass a budget this year. That happened last year. This would normally just be a bonding year. And I'm sure you all saw the governor's bonding proposal, I think, come out earlier this week. But what we have is this enormous budget surplus, which really creates an opportunity for us. And of course, some of that money is already spoken for, rainy day funds and things like that. But there is still a significant amount of money in play this legislative session, and really a lot of potential for us to move some of these issues forward. So, of course, people have different priorities, as you might imagine. And so, not to overly characterize who's where on these things, but generally, the governor and the House have been talking about reinvestment and investing in, things that are important in the state of Minnesota that have gone underfunded for a long time. So paid family leave is high on the priority list. Childcare is high on the priority list, things like that. And as you might imagine, the Senate has been talking a lot about how this huge surplus is an indication that Minnesotans are overtaxed and have an interest in giving as much of this back in tax cuts as possible. And so those two forces, sort of investment and giving it back in the form of tax cuts, will definitely be in play this legislative session. There's also from the Senate side of things and also the House minority side of things, I know proposals to invest some of this in unemployment funds so that employers don't have an additional tax for that. So that'll be in play as well. As Jane said yesterday, the elephant in the room is Build Back Better at the national level. I think we've all read about the fact that is we're not sure what's going to happen with that. That would be an enormous amount of money for the state of Minnesota for the issues we're talking about today, but the future of that is very much in question. So the other thing that's happening, of course, is it's an election year and every seat is up from the governor on down. And so our legislative friends will not only be engaging in the process of legislating and passing policy at the state level, but also thinking about going back home to their districts and what their constituents will need to hear reported back for an election year. So that's what we're walking into. All right, so this is when I first made this PowerPoint and delivered it to Representative Pinto and Jane, I think a couple of days ago. These next two slides, I think, were like 7 slides because so much happened last year. And so we're going to condense it down into 2 or 3 slides. And I'll do my best to get through a lot of information in a short amount of time. So last year, we had the American Rescue Plan Act dollars, and many of those dollars got to be invested in early childhood initiatives. And so there were the child care stabilization and facility grants, payments to child care providers. I think it was 70% of which was meant to improve wages for employees at those places, and also to upgrade facilities to make more spaces available for childcare. There are different investments in CCAP and sliding scale, and also to bring the reimbursement rate up from 25% to 40%, I think, which is great, but also well short of the federal standard of 75%. There were investments in workforce, not only to bring new people into the childcare workforce, but also to retain the people who are already in it. And then these last 3 bullet points are 3 of probably 12 or 15 investments. They call it's just supports, but family, friend, and neighbor support, the sort of one-stop network, and then the establishment of a family care ombudsperson position. So not only were federal dollars invested last session, but also state dollars. And there were some really, really cool community-based initiatives that got funded last session. This integrated care for high-risk pregnant women, which is really supports for Black and Indigenous women, supporting healthy babies, as well as very community-based collaborative work. The Dignity in Pregnancy and Childbirth Act was really training for contracted healthcare folks who come into contact with pregnant women, anti-racism training so that they can handle those situations in an anti-racist manner, which is fantastic. Home visiting program expansion, And then one that I know we testified on quite a bit was the extension of postpartum coverage from 60 days to 12 months. So not only federal investments, but state investments last session. All right, so this, this final list here is really, not only the investments in programming and supports last session, but, really, critically important were investments in system reforms that really set us up for what we're going to be talking about for the rest of this meeting and what we're going to be, trying to advocate for the upcoming legislative session. The first is the Great Start for All Minnesota Children Task Force, which is a 10-year initiative to really, re-envision the way that we do early childcare, early care and learning in the state of Minnesota, to really build a more comprehensive, effective model. So that's exciting. The Children's Cabinet Governance Study to really take a look at all of the oversight and all of the fragmentation and all of the silos that are involved in doing this work and trying to move forward and really see if there are things that can be consolidated, streamlined, made more efficient moving ahead with this work. The parent aware evaluation, and in particular, this is community consultation with an equity focus to think about the parent aware evaluation. And then the rest of the laundry list here, alternative childcare licensing models, updates to both the licensing system and the technology involved in that, a really important report about children in foster care and how they interact with these systems. And finally, family supports and improvement, which I have to look at my notes quick. So this is really about data sharing across systems too. So these overarching comprehensive reforms, I think, really give us an opportunity to come together this session to really think about how we can unify around an overall vision on these issues. And again, the Minnesota chapter of American Academy of Pediatrics, we're really excited. This is a top priority for us now. We have a number of really seasoned pediatricians who are, they've testified, they've advocated, and they're ready. So we're excited to interact with all of you and help any way we can move these initiatives forward in the upcoming legislative session. So thanks for your time today and for letting me be here and available for any questions when the time is right.
Thank you, Jeff. That was, you covered a lot in a very great period of time, and we look forward to being able to ask some questions at the end. So with that, we're going to hear next from Deb Fitzpatrick, and she and Laura LaCroix DeLune are going to give perspectives from their work as advocates and conveners of advocates in the realm of prenatal to 3 policy in Minnesota. So Deborah, I will invite you to the podium, and thank you so much.
Hi, everybody. Thank you. Next slide, please. Actually, I think Laura is going to start us out, so I'm going to turn it over to her, and then I'll be back with you in a minute. Okay, sorry about that technical difficulty. Can you go to the next slide, please? Okay, there's Laura.
Good morning, everybody. Laura LaCroix DeLune, representing the Minnesota Prenatal to 3 Coalition and Home Visiting Coalitions. You can move to the next slide. Deb and I wanted to take a little bit of time to highlight some of the opportunities for infants and toddlers and families with young children this session. You can go to the next slide. So thank you, Jeff, for setting the context for this session. What we wanted to do is highlight some of the challenges that continue to stack up for young families. So we know that there have been increased stresses and interrupted access to health and mental health care during the pandemic, and it's left many families feeling isolated and alone. The national AAP declared a national mental health crisis, and we're seeing increased needs with fewer resources resources across the state of Minnesota. So we'll talk a little bit about how, what proposals are coming forward to address that. We've seen increased costs for foods and diapers. It's really difficult to find diapers. It's really difficult to find formula, food. The supply chain has had a significant impact on how families are accessing essential goods, and that families with young children are experiencing economic pressures. The pressure to choose between work, childcare is really been challenging for young families. So next slide.
All right, I'm back. This is Deb Fitzpatrick from Children's Defense Fund. So hello, everybody. Thanks for the opportunity to come and share some updates on evidence-based proposals we expect to see this session. If you haven't visited yet, the Prenatal to 3 Policy Impact Center is a terrific resource, which I highly recommend. Specifically, the Prenatal to 3 Policy State Policy Roadmap provides guidance to state leaders on the most effective investments that states can make to ensure all children have the opportunity to thrive from the start. Grounded in the science of the developing child and based on comprehensive reviews of the most rigorous evidence available, the roadmap provides detailed information on 5 effective policies and 6 effective strategies. And I'm going to be lifting up 3 of those areas for you today. Next slide, please. So the first area is tax credits, and Jeff already mentioned that, you know, there's likely to be a lot of conversation at the legislature this session about taxes, particularly in light of the budget surplus. And over the past year, tax credits have been an especially important tool for stabilizing families. The vast majority of Minnesota parents with low incomes have spent their federal child tax credit payments on basic needs such as food, housing, utility bills, and education, all things which help give their children a stronger start in life. Before the federal rescue plan made the full federal child tax credit fully available in 2021, 322,000 Minnesota children and families with the lowest incomes received less than the full credit or no credit at all. Now, as Jeff mentioned, it's very unclear what's going to happen with any of these policies at the federal level, including the federal child tax credit. But that doesn't preclude the state from making changes to its version of working family credit. And that policy could be improved to increase its poverty fighting capacity, as well as its power to improve economic stability for families with young children. As the legislature considers changes in the tax code, again, in response to the budget surplus, we expect to see some proposals to improve the working family credit. Those could include increasing the amount of the credit or allowing the option of monthly payments, building on what we have learned from the CTC. Next slide, please. So reducing administrative burdens is a second proven policy at the Impact Center. Across Minnesota's working family supports, the pandemic, it created opportunities to deliver government services in new and innovative ways. We've learned a lot about how we can create a more effective and efficient system. I'll be lifting up a few proposals that build on what we have learned, but there are no doubt many more. Among COVID innovations, food advocates, for example, are looking at continuing the successful model of delivering summer food support to families through electronic benefits transfer cards. This gives families the opportunity to buy food where they can and in ways they can and the kinds of foods that they need for their families. In the category of simplification and alignment of program requirements and administration, county administrators, the United Way, among others, are prioritizing a proposal from last session that would create more uniformity in family reporting for the Minnesota Family Investment Program and SNAP food support. This would make it much easier for families who currently fill out monthly 8-page forms, and would make it much easier for the counties as well to deliver these supports to families. Finally, the state is making progress in the area of increased coordination and support for families accessing state programs. However, some of those gains may be wiped out if funding isn't forthcoming for the preschool development grant hubs. These are hubs that have been developed all across the state to help families access the many different kinds of supports available to them. And the impact of these hubs could be increased if we develop a full statewide network. So we expect to see some proposals in these areas. Next slide, please. And the third evidence-based proposal I'll cover today is paid family and medical leave. Jeff already mentioned it briefly. Just to kind of get people up to date, in 2021, Representative Richardson's House File 1200, which creates a state social insurance program modeled on successful programs in other states and Minnesota's UI infrastructure, passed through several House committees and eventually the full House as part of the Omnibus Workforce Bill. It was also included in the governor's budget. This session, we expect to see proposals to use the significant budget surplus to fund the one-time startup costs, but also possibly front load the trust fund, which would allow benefits to flow more quickly to working families. I expect Representative Richardson might have a lot more to say on that front. So at this point, I'm going to turn it over to Laura LaCroix-DeLune, turn it back over to Laura to share proposals in other areas, and I'll be available for questions later.
Great. Thanks, Deb. Next slide. So I wanted to highlight a few of the maternal and child health proposals that we know will be moving forward. I do not have bill numbers for these, but we will work with the elders to provide this information at a later point in time. We do know that there will be some bills that are moving forward to try to increase access for infant and early childhood mental health services to address some of the developmental delays that we're seeing with babies and toddlers. This is important because in early childhood, mental health appears as a developmental delay for a child. And what we have heard from a number of providers who work with families and communities is that we're seeing anecdotally hearing stories about increased referrals to address developmental delays for babies. And there's this new term coined COVID babies, which is not necessarily a positive term, but this will be one of those strategies to try to help address the needs of young children. We also know that there will be bills moving forward to try to help increase access to doula care for the Black, Indigenous, and people of color in communities around the state, including greater Minnesota families during pregnancy. Pregnancy care is more challenging to find in greater Minnesota. And as you heard Jeff speak to earlier, we have a number of bills that passed last year to try to help address some of the implicit bias among labor and delivery teams throughout the state. So there's been a big movement in the BIPOC community to try to have access to doula care. Some of this might be related, some bills are related to Medicaid and others are around certification for programs. Another area that's moving forward in maternal child health this year is to seek Medicaid reimbursement in Minnesota for pasteurized donor human milk. There is a need for access to donor human milk for families who cannot breastfeed themselves. And in some states, they actually are reimbursing families for that cost through Medicaid. And we are hoping to move, there are people who are leading in this space and hope to see that happen here in Minnesota. Next slide. In addition to the previous maternal child health policies, there are a number of family home visiting policies that are moving forward this year as well. There is an effort to provide voluntary universal home visiting services to all families who give birth. There's about 69,000 births annually in Minnesota. So this would allow families to have access to voluntary services and these regardless of income and location. So that is moving forward in the House, and the Senate is considering this legislation as well. There is a separate proposal that is time limited universal home visiting services, really focusing on the use of the Federal American Rescue Plan Act, which is what ARPA stands for. So these are federal dollars. There are about $1.2 billion remaining to be spent in Minnesota with the focus on helping families and the state move through the pandemic. So the purpose of this legislation is to use these time-limited funds and provide family home visiting services to anyone that gave birth between 2020 and 2023. And then the other family home visiting bill that would be moving forward is to expand the voluntary long-term home visiting services. Because we've seen, because of the increased isolation, the challenges of identifying or getting well baby visits, we know that a number of families are going to need some longer term help as we move forward through the pandemic. Next slide. Early care and education remains a top priority for families across Minnesota. And the advocates in childcare and early care and education have been actively working with our national delegation or federal delegation, excuse me, to maximize these federal opportunities. In the Build Back Better legislation that Jeff mentioned earlier, there are efforts to increase affordable childcare and early education for all families. So advocates will remain focused on that piece of legislation because of the impact that will have for us in Minnesota. So we'll continue to work on that. There are also a number of efforts, and we don't have a specific bill yet, but to increase access to affordable early care and education through investments in our child care assistance program. So CCAP is the acronym that's used for that, and then the early learning scholarships. Both of these funding streams, along with Head Start and Early Head Start, help reach a number of families, and we want to make sure that we have resources to provide care. The lack of care, along with the pandemic, the interruptions of care, have made it incredibly challenging for families to access, and we want to help ensure families don't have to choose between work and caring for their children. We know that there will be an early care and education workforce study. This is being moved forward, I believe, both from the, it's called the Birth to 8 Workforce Group, and the Crisis Work Group will be moving forward a study. And this is because we haven't had a workforce study done in about a decade, maybe a little bit longer. So we can better understand what the challenges are for getting people in the early childhood workforce. There is one more childcare legislation that I want to highlight that's not on this slide before I go to the last point, but during the pandemic, when the governor had emergency health powers in place, the state agencies were able to put waivers in place to help make current policies more flexible and easier to implement during a pandemic. So there is some legislation that is going to be moved forward this session to reinstate the extension of some of those COVID-19 program waivers specific to the Child Care Assistance Program that help programs stay open. So there's a number of different policy changes in place that relate to paying for care when children are out due to COVID. So we want to have some protections in place for childcare providers as well as families. So we'll put some of those the goal is to put those policies back in place and a time limited, that would be time limited, to help us get through the pandemic again. And then finally, I want to highlight the effort to create a brand new department, and that is a Department of Early Childhood. As Deb mentioned, the Prenatal to 3 Policy Institute has been promoting best practices. And what we have seen across the country is when there is a department in place that is focused on early childhood services, that you get better efficiencies and better outcomes for families. So this is something that there's growing support around this, both from advocates and legislators, both in the House and the Senate. Next slide. I think Deb and I wanted to make sure you had our contact information, and we welcome people to reach out to us if you would like to be part of any of the advocacy efforts that you've heard about this morning. And that would be my final slide.
Thank you, Laura and Deb, for summarizing a vast amount of information. We've already had one question about having slides available for people at a later time. And one thing we do several days after the forums are complete, we do repost the entire event. But I also think when we will repost your email addresses for people to get copies of your slides. So we'll just put that out there right now. So thank you. And I also want to just say to the audience that the future forums are going to, we will be paying more attention to the Prenatal to 3 Policy Impact Center, which is now at Vanderbilt University, that both Deb and Laura referenced as some ways that we will be working to build knowledge among our community of people concerned with prenatal to 3. So at this time, I'd like to welcome our legislators to the podium, and we're going, I'm not sure if Representative Richardson is here yet. I think what we have is we're amazingly running a little bit ahead of schedule, which sometimes doesn't happen. But if I might, I think I'm going to ask Representative Lisa Damuth if she would be so kind to start us off with her perspective on what the upcoming legislative session looks like from her experience and standpoint. So Representative Damuth, we want to thank you and welcome you. And I think that's how we'll begin. So.
Good morning. It is good to be with you and focusing on such an important topic when it comes to our youngest Minnesotans. It is my honor to be with you this morning. And I appreciate hearing from the presenters so far, the upcoming session and some of the focus and some of the work that's been done. I'd like to take just a moment to reflect a little bit on the work that was done specifically as we finished up our special session and the work that was done specifically with the Family Child Care Task Force. And I'd just like to hit a couple of those high points. Some of the area, and we know Family Child Care Task Force was set up in the previous session to make sure we were addressing some of the needs to make sure that that industry was going to be continued to set up to serve our areas all the way across Minnesota. In greater Minnesota, where I'm from, we have centers, but we also have a number of family child care providers. Some of the work that was done out of the task force was to modernize some of the regulations. As was mentioned earlier on this forum, the Office of Ombudsperson for Family Child Care Providers is going to be especially important to help with licensing, compliance, and the other issues that are faced by our providers. There's also work being done on orientation training for family child care license applicants, those that want to enter this important industry. Active supervising training, family child care training advisory committee that will be set up, special family child care changes, and a frequently asked question webpage. Those are just some of the things that was done, and we're seeing those things that are coming through. But as we look forward to this next session, I believe the best investment that we can make is in early learning scholarships, specifically in the Pathway 1. When we look at who we should be centering our conversation around is definitely on the child. How can we best serve the children that are in need, both in education and in child care? The Pathway 1 scholarships allows us to have dollars that would follow the families and the children that are eligible. So as they go through transitions in their life, the dollars would follow those children. A couple of the other things that were mentioned that I'd like to touch on is we know how important the family, friend, and neighbor program can be for families that are looking for alternative care. We know that we're looking at a budget surplus this year, as has been talked about. The paying back of the unemployment insurance for our businesses is something that we'll need to tackle and take care of, so we're not additionally burdening our businesses with taxes. And that flows into our parents that are working. But as they are looking for people to help with the childcare, thinking specifically, how could we provide tax relief in the way of keeping some of our senior members in Minnesota, I believe is a very important thing to do. We know that we are still taxing Social Security, and that is causing some of our seniors to leave Minnesota. But if they would choose to stay in Minnesota, especially during the winter, where a lot of them tend to go because of weather, that family, friend, and neighbor piece could be addressed by having those grandparents or the grandparents that maybe aren't blood related, but the ones that are here and are willing to advocate for parents and to help watch children, but also they can also help with our families and kind of give that mentorship for the moms and dads that are maybe looking at it. So the tax relief, even though it doesn't seem specifically related, I think it's an important thing to look at. Again, I am happy to answer any questions going forward in the presentation and in the question portion of this, but I believe that best investment, whether it is some state dollars, but especially if you get federal dollars, will be in the area of early learning scholarships. Thank you.
Thank you, Representative Demuth. That was a very helpful, and I'm grateful you're going to be able to stay around for questions. So that's lovely. Well, Senator Wickland, I am going to ask for you to speak now. We are delighted that you could be with us. I know you've been able to attend our forums in the past and have spoken for us also. And so I just am going to invite you to come forward and speak. Thank you.
Well, thank you. Thank you very much, Jane. I really appreciate being asked to be here today and appreciate these forums. They are always a great source of information to me as I do my work, and I know that many others feel that way as well. And so I'm very glad to participate at this time as we're getting ready to start session in a couple weeks. I think that it's been great to have the legislative overview and some of the proposals that might be coming forward. And thank you to Representative Demuth for the updates on some of the great things that came out of last year's session. And I thought I'd talk about, we know that with the surplus and additional federal money that hasn't been allocated, that we do have a lot of opportunities in 2022. And we need to think about, you know, a lot of different people will have different priorities. And certainly one of the key priorities that I will have is to assure that there's focus on early childhood. We know that giving kids, more kids from prenatal to pre-K to kindergarten, giving more kids opportunities for a great start is something that, you know, will have lasting impact on our state. And so, you know, I think that any of these investments that address children at the earliest stages will have a great impact, and that is going to last them a lifetime. So I wanted to just comment on some areas that I think within the early childhood care and education field that I think we could be doing some things this session. One area would be to address childcare supply. We know that as we face worker shortages, one of the key reasons workers find they can't go back to work is if they can't find appropriate childcare. So I think that we really need to look for ways to help providers, help them stay open during these challenging times now during the pandemic and going forward. If we can help providers who have closed, if we can help them reopen, I think that would be an important task. If we could maybe target some additional funding, we've seen that the child care stabilization grants are an excellent way to help a lot of providers across the state, family child care as well as center-based child care. But if we could find some additional funding, maybe we could target some specific provider types to receive an additional bonuses or supplements, maybe to increase the supply of infant toddler care or special needs care, extended hours. I've been a proponent of looking for ways that we could do that. I'd like to see us look at that this year. And then are there ways that we could encourage new providers to open? We passed some language last year to provide additional training support, business training support for childcare providers. Is there a way that we can recruit new providers into training courses that would allow them to enter the field more quickly and be supported as they do that? I think one of the things that isn't related to the pandemic, but just ongoing, is the need to increase wages for childcare professionals. And looking at ways, can we raise the subsidy rates? As was mentioned earlier, we still are not very close to what even the CCAP federal recommended reimbursement rates are. So I think we have a ways to go on that. And maybe to support providers in the field, providing access to benefits or supports, mental health supports, or healthcare insurance. If we could find tactical ways to help providers in those areas. I know that's an area of concern. Providers don't make enough to be able to afford adequate healthcare coverage. So I'd like to look into ways we could do that. In terms of parents and families, we know that childcare is very expensive, and addressing affordability is another area that we should look at. Can we help more children and families access subsidies and scholarships? I'd like to see us look for ways to increase the number of families who are able to access these tools to help them have their kids in high quality care and be able to work. And as was mentioned, tax credits, I think that's something that we definitely will hear conversation about, and I think is a good way to also help parents possibly in this time. Also, we had Senator Nelson introduced a bill, and I think it's been multiple sessions for tax credits for childcare providers that I've been a co-author on, and I hope maybe we can have some discussion about maybe that's another way that we can incent providers to stay in the field to provide child tax credits for them. And last year we did fund some programs that were mentioned to provide business training to childcare providers and to provide access to the one-stop shop. Some of these I'd like to review. Are there ways that we could add additional funding to a program that maybe if they had more applicants than they could fund, maybe this would be an opportunity to use some supplemental budget money to provide more access to these programs. And I guess then lastly, I wanted to reinforce a few of the items that were brought up that I'd like to work on this year. I think access to mental health care is going to be a huge issue that we need to look at how to increase the supply. I know that access to mental health care for children is especially difficult, and if there's a way that we can increase the supply of, or the ability for parents to access the appropriate mental health care for their kids, I think that's really important to work on. And the reduction of administrative burdens. I'd like to see us have more discussion about that. We did talk about that in the Senate last year. I'd like to hope that we can have that discussion again within Senator Abler's committee about changing the administrative processes for MFIP and SNAP and trying to make less of a time tax on people who are already have a great deal of things on their plate. So I'd like to see that move forward as well. And certainly open to discussion about the reinstating some of the COVID provisions and hope that those will get discussion within the Senate soon early in session. So I'm happy to answer any questions, and I think it will be it'll be a very interesting year and a lot. There's always the other items like bonding that will take a great deal of time and discussion. So that, in addition to this, the surplus, it will make for a very interesting session. And thanks again for having me today.
Oops. Senator Wicklund, thank you very much. I think I'm still got cold fingers. There we go. So thank you for that. And I want to just say to both you and Representative Demuth, you've given us some really important touchstones for further conversation. And we've gotten some questions in that we'll be picking up on, but I also want to just acknowledge that we have some additional legislators in the audience. Liz Bolden, Representative Emma Greenman, and Representative Amy Wasilwick. And so we will be here. I don't want to say we'll tap into you if you have there's a question specific for you, but we will have a chance with the Q&A to raise some specific questions which have come in. I want to just call out a couple of things. One is that, as you heard earlier, some of the bill numbers, we've had a question about that, are not assigned yet. And the advice from Representative Pinto that we've exchanged a little bit is sometimes contacting your own legislators will be important. But after the forum is over, we've got, we'll put up a reference to the legislative librarian, I believe it is, resource, so that you would be able to make some connection to get specific bill numbers. But we will be following up with that. I'm wondering, is Representative Richardson able to start at this point?
Hi, I am here.
Oh, wonderful. May we have you put your video on and then we'll see you and I'll take myself out. There you are. Welcome, Representative Richardson. Thank you for being with us.
Thank you for having me this morning. And thank you to Representative Demuth and Pinto for putting on this event and everyone who made it possible. I am really excited to be with you this morning to provide a little bit of perspective and overview as we're preparing to move into another legislative session. I know that right now, things are feeling really tough in a lot of sectors, and for early childhood and early learning, it's no exception. We're continuing to feel the impacts of the COVID pandemic, and the challenges that we had within the sector prior to COVID have only increased and intensified. So some of the legislative priorities that I am most looking forward to getting some traction around include the work that we've been doing around paid family and medical leave. And it's really critical as we think about the work that we are doing from prenatal to 3 about the importance of families having the ability to take the time that they need, particularly after, during pregnancy and after giving birth as well. And there's really good data out there that shows us that states with paid family leave and medical leave policies have better outcomes when we're thinking about some of the outcomes related to prenatal and those early years. And those better outcomes include things like reductions in the number of babies born with low birth weight, which can come with significant lifelong challenges. It also reduces the number of preterm births and prematurity, low birth weight. Those are all things that can have an impact on development later as well. And the unfortunate data that we know as a nation is that the vast majority of people who give birth are oftentimes going back to work before it's medically advisable for them to go back to work in the name of economic security. And so we can definitely do better in that result. When we look at the fact that 25% of people who give birth go back to work within 2 weeks. And from an early childhood perspective, you can't even get a child into an infant care program until they're at least 6 weeks old. We know that there's a huge disconnect there. And so we have an opportunity to continue with the movement that we've made on the paid family medical leave front to continue to advance that work. It's going to be really critical to the overall health of the little ones that are born here in Minnesota. We know that there have been intense pressures in terms of looking at workforce challenges in the early childhood field. And so looking forward to continued conversations and discussions about how we approach the workforce challenges. And there's some proposals in that area that we are really excited about continuing as well. It's also an opportunity to continue to look at the work that was done within community as part of the House Select Committee on Racial Justice. It's been really great to see Representative or Chair Pinto leading the committee and continuing to use the data that we pulled together for that House Select Committee and the recommendations that came from community on ways that we can be working to ensure that we're seeing better outcomes in this prenatal to 3 space. Just want to also take a moment to talk about some of the maternal health and the infant health initiatives that we were able to accomplish last session. The Dignity in Pregnancy and Childbirth Act bill was finally able to get across the finish line. And that bill is really looking at supporting women who are pregnant and also supporting our little ones to ensure that we're working to reduce the disparities that we continue to see within not only the nation, but the state as well. And those disparities include the fact that we know that Black women are 3 to 4 times more likely to die from a childbirth related cause when compared with their white counterparts. And you can control for housing status, income, education, insurance status, mental health and substance use disorder status, and general health and nutrition. And we still see that those disparities exist. And we also know that Black infants are twice as likely to die when compared with white infants within the first year of life. But we found, there's also data that shows that there are things that can mitigate these deaths, the vast majority of which are preventable. We know that when Black infants have Black pediatricians, that mortality rate is cut almost in half. And so work that we were doing with the African American Babies Coalition to increase the diversity of our healthcare workforce is going to be really critical in being able to build on the gains that we made last session with that. We are working with the Integrated Care and High Risk Pregnancies Work Group. We expanded our investment to continue to work to decrease the number of low birth weight babies that are born within the African American community as well. And one other area that I want to uplift that I'm hoping that we're able to get some traction on this upcoming session as well relates to communication equity. I've been doing work over the last several years with Metro Deaf School. And what we know within the data is that oftentimes kids who are born who are deaf, deaf-blind, or hard of hearing, they're oftentimes born to hearing parents. And so there can be communication challenges, especially in those early months. And so working to ensure that there's support of things like home visiting and communication access and language access for families who find themselves caring for a child that they're struggling to communicate with, and ensuring that we're not losing those precious early months of brain development, because we know that those first 3 years of brain development are so critical to what's going to happen in the future. So I'm excited to continue to work with all of you on working to create systems in Minnesota that are going to give all our little ones the best chance at reaching their full potential. Thank you for having me this morning.
Thank you, Representative Richardson. Very thoughtful presentation. And again, Representative Dameth and Senator Wickland, also major thanks. I wish to acknowledge we have a couple of other people that are in the audience who are elected. Representative Sydney Jordan and Ramsey County Commissioner Mary Jo McGuire are with us. So we're grateful for you to be here. We are poised now to begin talking about responses to questions that have come in. We have kind of this capacity where presenters can type in an answer, but I think it's a really good opportunity, since we have a little time this morning, to take on some questions, and even those that have been answered via typing, we can ask to have addressed. So at this point, let me just take on, I'm going to pull up my own Q&A, and I think we've mentioned that the presentation slides will be available on the forum website, but if you want the individual slide decks, you'll be able to see who the presenters are and get information directly from them. So the community, there's a question about how will the early childhood hubs, which is what's through the preschool development grant proposal, be passed? What populations, what parts of the state will this benefit? How affordable will this access be for low-income working families? And then there's a question also about early Head Start, that it is available only in certain parts of the state, and what will be available for those families who might not have access to Head Start in their community. So we have, there's actually one more question with that, but we talk about the alternative funding. The question is about alternative funding options for families who fall outside the CCAP limit, such as a single mother who earns more than $40,000 a year, but doesn't have a child care fund for her 2-year-old. So there's a question then about, will there be a push for increasing the cap on eligibility? So Deb Fitzpatrick has written an answer, but I don't know if Deb wants to weigh in with what you've had to say. And then I will invite anyone else from our panelists to respond to that.
So Jane, thanks for the opportunity. Yeah, I would just call attention to my response in the Q&A because there's a link there to more information about the community hubs that were funded through the preschool development grant. At this point, they're pilots, so they're scattered around the state of Minnesota. I think the proposal or idea would be, could we set aside some funding to take what we learned from that experience with those pilots and expand it to the entire state. So right now it's just pilots, it's in various areas. It is designed to support families across the income spectrum, but especially low income families. And again, it's the idea of bringing together navigators really to help families, kind of access all the different kinds of supports that are available to them. I welcome other responses to the other two pieces, but I would say I would expect we'll see some proposals to, increase the investments in early Head Start. And there are a lot of conversations going about how we can improve the CCAP program to serve more families. And again, that some of those proposals may be looking at increasing eligibility. I will stop there, and there may be some other responses or thoughts from legislators or other panelists.
I will just say the floor is open for any of our elected people to step in here.
Well, I'll maybe do so. Hello, everybody. Representative Dave Pinto from St. Paul. And so glad to have you all here. And Jane, thank you for the hosting. And this feels like maybe a good opportunity to just acknowledge that, as I think Representative Richardson had alluded to this, that we've had from the House majority a series of proposals in past years to make significant investments in early childhood in general and in early care and learning in particular. And I think folks can expect that we will continue to be advancing those proposals. Many of you know I certainly will want them to be just as big as we possibly can because we're operating from a massive, massive deficit in this area. And I expect it to be balanced as our past proposals have as well. So to this question, then, I certainly would expect that there'd be funds there to expand CCAP and have better rates and more eligibility, and for early Head Start, and for other components as well, to be clear, to make sure that we've got lots of different opportunities for families, because we know that this is an area of extreme need. And it's necessary for both the short-term economic development in our state and long-term, and to support families and all kinds of good things. So this question kind of is a nice opportunity just to make that point again, that I would certainly expect to see proposals in this area. Thanks.
Great. I'm going to just give a moment here. We have a question for Representative Dameth that she has responded to, but I think I just want to call it out and just give you a chance to talk a little more about that, Representative Dameth. The question is, you mentioned that pathway 1, which is to stay with the child. What will be available for little ones, birth to 2, since pathway 1 is only available for 3 to 5, unless you've experienced homelessness in the last 24 months. So I think maybe you want to just go ahead and speak about that. I know you've written an answer too, but thank you.
Thank you. Thank you for the question. I think that's an important thing to talk about. As we are looking going into this next session at potential additional dollars, especially federal dollars, potentially, I am interested in expanding both the age of eligibility and looking at increasing the percentage of household income according to the federal poverty guidelines to make sure that we are meeting more children and addressing the needs of more families going forward.
Thank you. That's very helpful. We have a question about the Department of Early Childhood and just in terms of the response from the Children's Cabinet that has been requested by the legislature. And Laura LaCroix DeLune, you typed a response. Do you want to just go over that?
Sure, I'm happy to just expand. The legislature did ask the Children's Cabinet to take a look at the possibility and what it would take to create the new department. As I mentioned, there has been increasing support for this idea. And the Children's Cabinet is due to have a response back in February. However, no public information is yet available.
And Jane, I might just make a note for folks who maybe haven't been following this, that there was a bill that advanced somewhat through the House last spring with some bipartisan support to have a department such as this. This is an increasing move in states to consolidate their programs for early childhood in one state agency. In many states, it's an existing state agency. So like in Minnesota, that could be in the Department of Human Services or in the Department of Education, or even the Department of Health. But there are a number of states that are moving to set up their own separate agencies for this. Washington State, New Mexico, a number of others. And so what happened is that that bill kind of transformed into this idea of asking our state's Children's Cabinet and the administration to look at governance and to say what are some good ideas from Minnesota for governance, and to kind of make recommendations that if we wanted to consolidate, how could that work? So that's the report that we will be seeing coming out in the next couple of weeks. And I know those conversations about how our program should be structured will continue. There was an Office of Legislative Auditor report in 2018 that discussed fragmentation in the system. I think this would be obvious to anybody who works in this area. If you're and this is focused in this area is a lot on early care and learning, but if you're a provider of those services, if you're a family, there's multiple funding streams, multiple eligibility, it's a real challenge. And there's been heroic work by our state agencies to try to harmonize that and coordinate. But our committee in early childhood is in pretty close contact and work with a total of 5 state agencies. And that can cause some challenges. Again, people are working really hard to coordinate, and there's certainly some advantages. And however you design a governance structure, there's going to be some challenges and inefficiencies. When you move programs from one place to another, you maybe put them with programs they belong with, or maybe take them away from other programs that they could also belong with. And so that's complicated. And so those are conversations we're going to continue to have. I personally am really excited about it and continue to be. And we want to make sure that we're being thoughtful and doing it right. And so we'll be getting that report and hearing what that has to say. So just to provide some broader context for folks about that.
Great, thank you. Senator Wickland, we have a question about if you could say a little bit more about your thoughts about infant care subsidies and what ideas you have.
Sure. My thoughts on that are based on what I've seen. Other states have made a point of targeting either through their child care subsidy program or through some of the stabilization grant programs to give additional amounts to providers who engage in different or specific kinds of care. And it seems like one thing that I've heard pretty consistently that's a greater Minnesota issue and a metro issue is that there's limited access to infant and toddler care. And obviously that comes from, how few or the small numbers of infants and toddlers that one person can take care of. And so increasing the monetary reimbursement for rates for doing that, it seems like one way that we could address, we might be able to address supply. So I'll be looking into what other states have done and maybe we can come up with a proposal here. I think one of the other questions about, our scholarship amounts sufficient? I think that's another thing we need to look at. As Representative Demuth has mentioned, expanding eligibility to other income levels. That's one thing we need to look at. I definitely agree with that. I think we also need to look at the amount of the scholarship and the subsidy payments because they aren't adequately covering the cost of care, and it's hard to get more people to want to take in children or start businesses if they aren't able to cover their costs. So it's definitely an issue to look at. And just the last thing, I see one about increasing parenting education. That's a good idea. We should look at, we have a strong ECFE program in Minnesota, the Early Childhood Family Education Program. And I'd be interested in knowing whether there's a need to support that program in our school systems, if there's a way we could increase funding to those programs, because I know they're very valuable to parents and families. Thanks.
Hey, Jane, one thing just to note for folks on the issue of infant care subsidies, I don't know if this came out so much earlier, but I want to make sure that folks notice this, that as part of the 2021 budget, Jeff Bauer had referenced earlier that we increased the rates under the Child Care Assistance Program, or CCAP. The rates for infant and toddler care were increased to be higher than the rates for preschool age kids. Of course, we want to make sure we have decent rates for all, and they're still way too low. But the rates for the youngest kids, and we're set at the 40th percentile, and the older kids at the 30th. I'm pretty sure that's right. Please somebody correct me if that's wrong. And so because we know it's those youngest kids who are the most expensive and the most challenging. We know that parents, that's the time of life, even in those first 2 years, where parents are the most slammed and have the hardest, have the lowest wages, and just in the worst possible position. And then we also know with the brain science, that's the most important time of life as well. It's in those first 24 months. And so just to reference that we already do have a precedent in our state for subsidizing infant care at a somewhat higher rate. As somebody who's worked a lot with the Elders for Infants, which Jane is with, many others, they're a co-host of this forum, they do not let any of us forget the importance of infants and toddlers. So anyway, thanks.
Can I just say one thing about like an alternative to subsidizing care in the space would be, or a different way to think about subsidizing care in the space would be paid family and medical leave. We know that a lot of families would like to take care of their own infants, especially during those first 6 months or a year. And so this would be an important opportunity for us to address some of the shortages of care by allowing parents to take care of their own children. So I just wanted to bring that into the mix as well.
Thank you.
I can add, Jane, if I could add a couple of thoughts. I saw in the chat that the question about increasing parenting education, and I know Senator Wicklund already addressed that. One of the other effective ways to help parents as they're learning how to parent is home visiting. And I'm a great proponent of home visiting and the positive effects that can have in families, both children and parents. As far as the paid family leave, I believe there's another way to look at that. There is an importance when there is the opportunity for parents to stay home with kids. The way that it is laid out right now actually would increase costs for both employers and employees all the way across the state of Minnesota. I think another viewpoint on that would be is if we could offer health savings plans that employers and employees could take advantage of, possibly some tax incentives to businesses that are willing to offer this option that could be higher and above what is being proposed. And so there's a few other ways to look at it that could be more effective. I'm in the workforce, but I definitely, my kids are all grown and I have the opportunity to do some different things, but our employers having the options to offer that in this market of needing to attract other employees, I believe is a better way to go on it.
And I would just like to add a little bit, and I appreciate Senator Wicklund also lifting up paid family and medical leave, because when we look at the costs of not having paid family medical leave, they're significant. The cost of preterm births are astronomical. I've talked with individuals who talk about the shock of receiving bills that are hundreds of thousands of dollars or near $1 million for a child who was born premature. There are also the ongoing costs of the support that children are going to need across their lifespan when they are born significantly premature. My own little sister was born extremely premature. She was less than 4 pounds when she was born. And as a result of that, there are lifetime consequences and lifetime higher medical costs. And so we know that with paid family medical leave, we can decrease the number of preterm births that are happening. We can decrease the number of low birth weight babies. And in addition to that, the ability for parents to be able to provide that important bonding and that experience for both parents to be available has lifetime consequences and impacts as well. I saw something in the chat around literacy and parent education and parent support. Those things are only possible if we're providing lifelines and support for families to be able to take advantage of those things. Our families are experiencing stressors at levels that have been unrelenting for the last 2 years. And if you are worried about where your next paycheck is coming from, how do you even start to think about how am I going to get enrolled into this early learning program with my child, or how I'm going to take advantage of this when people are just really trying to survive at this point? I think we have an opportunity, and there's also funding available with a huge surplus that could have us looking at ways that we could even take some of the burden off of small businesses and also off of employees for the first couple of years to help launch a paid family leave program.
Is it okay to jump in, Jane?
Yes, go ahead. Thank you.
So I wanted to just circle back to the parenting education, the maternal and child health focused, and the literacy piece. In the universal home visiting legislation that will be coming forward, this will be available to all families that give birth. And the goal would be to go retroactive through the start of the pandemic. With these types of home visits, when it's universal, it's between 3 and 8 visits for a family, and it really is to connect them to community resources, to health systems, so it's a nice way to help us shore up a lot of these challenges that families are facing, in addition to these other policies that we just spoke of.
I think that's very helpful. Thank you. And the isolation is something we've heard about in the Prenatal to 3 Coalition, that when home visitors go in, they find other kids who have had lack of access to supports and they need help too. So I think that's a lot of complications. Yeah. Okay, so anybody else want to add anything right now? We'll take on a new question. One of the things that's come up about the early learning scholarships, I think this was from Judy Temple, our professor from the university, I think, but being able to have enough resources within from the scholarships to raise the salaries and also to increase private investments. And I think there is an evaluation underway now regarding the early learning scholarships, or maybe it's more about parent aware. I've got to get things straightened in my head. Does anybody want to take on that one?
Maybe I'll just clarify about the study you referenced, Jane. And this is a tangent, but as long as you've just mentioned it, that there are actually 2 studies or reports going on right now about our states, what's called a quality rating improvement system. So every state in the country has to have one of these QRISs. I think maybe every state but one has one, and ours is called Parent Aware. and it's meant to increase the quality of childcare and early learning. And you might see when folks are driving around, there's the stars and 3 or 4 star rated, that kind of thing. There are concerns about Parent Aware from various directions, and of course, there's a lot of support for it too. And so there's 2 things happening right now. There's going to be a report that's going to come out in the next couple of weeks. I think one of Jeff's slides referenced this to examine how well it's working for providers, but especially for providers of color who've expressed concern about how it's working for them. So we're going to hear a report on that. And then there is a validation study to make sure that it's working in a way that is really connected to enriching experiences for kids. That's a much longer term study that's going on. So that's that piece. But then we should probably come back to the question about scholarships then. If anybody wants to hop in, Jane, maybe you can just restate what the question is. Oh, you're muted.
Couple of them. One is regarding the interest in expanding funding for early learning scholarships. When the vouchers were rolled out, the advocates argued this would lead to an unleashing of private sector investment in early childhood. The availability of these vouchers would lead to a rush of new providers, both center and home. Instead, supply has fallen, and obviously the pandemic has been a major contributor at this. But the question then is, are scholarships large enough to pay decent wages to caregivers? And that's a question I'm not sure who would like to tackle.
I'll maybe just provide a little bit of context too, and then see other folks leaping in that there has been, so we know that every one of these approaches to early care and learning is deeply underfunded. That includes the scholarships, and that includes CCAP, includes our pre-K program in the schools. Every one of them is reaching only a small percentage. Also includes home visiting, I'll note as well, only a small percentage of families that would benefit. And so the money ends up being rationed in various ways. And there has been a cap on the individual amount that can go for scholarships for families. So I guess what I'd say is, no, there's not enough money to go to really pay what we would want folks to be paid. And we're trying to have dollars stretch as much as they can. With every one of these systems, we're kind of taking the poverty level wages that are in the sector and taking them for granted. And then on top of that, trying to make sure that we at least have families be able to provide care from these people being paid poverty level wages. So as we think about what to do, to my mind, we need to acknowledge not only providing families with the care and learning and services that they need, and all those services, not just outside of parental care, but also in parental care, but then to also make sure that people who are providing those services are being paid decently. And I guess my general answer to, I think, Professor Temple's question is that no, it's not adequate, but can be adequate as we make more investment. And with a total of $8.9 billion available, 7.7 in the surplus, plus there was $1.2 billion that got carried over from last year. Boy, it seems like now would be the time to make those investments in these different areas. But if other folks have things they want to jump in on.
These are challenging questions and challenging, and again, come back to this. Here's another question from, this is Sarah Bull from Safe Families for Children. What are you doing to address the reality that CCAP policies have basically eliminated the availability of legal non-licensed providers in Minnesota? Also in my community, there are 0 CCAP and Parent Aware 4-star rated providers. This means that even if you pour additional funding into those programs, there's no option for childcare slots for families. And what's being done to incentivize childcare providers to work with publicly funded programs. So this is a tough one. So
I guess I'll jump in on this too, though. Anybody, please feel free to unmute at any point.
Feel free.
Yeah, please. And that is challenging. I guess maybe working backwards, and I want to make sure the audience recognizes that all this is coming from that Q&A panel, and my understanding is audience members can see these. So hopefully you're able to kind of see what we're talking. I sure hope y'all can see what we're talking about. So the incentive to work with public funding programs would of course be to make sure that there is significant funding in those programs. And I want to make sure we just step back and recognize that that as soon as a child turns 5, our society takes a lot of responsibility for not only their learning, but also for their care. And we discovered this during COVID when schools were in-person learning was shut down, and we recognized how a lot of K-12 is childcare in addition to being learning. And so for many of us, the thought is that we should have significant public funding to support the sector, not to say that we replicate exactly what we have in K-12, but to recognize there needs to be, this is a public good that really only works if we put funding in. And so in response to the question, what I would say is that the incentive is to have this additional funding, and that as that comes in, we're able to support providers to pursue quality. And in our state, currently that's defined through Parent Aware, recognizing again, that's being studied and examined, that there's lots of support and then folks who have concerns as well, but to make sure that we are providing the financial supports so that providers can pursue what they need to and can provide the most enriching experiences for kids that they possibly can. But right now we have this fragmented, messy, underfunded system that makes it really, really challenging and means that families and providers have to scramble and just do what they need to do. We had a mention earlier about Build Back Better, and just a reminder to folks that if that congressional law were to pass, then the federal government really is stepping in and saying, hey, we need to have that public funding, and the federal government has resources that the state does not have to the same degree to make sure that every single family provides support. And the federal standard would say that that support, families should not be putting in more than 7% of their income. Of course, once a kid turns 5, the federal standard is 0%, right? Because we don't make families pay. But okay, fine, 7%. We are far from that, and Build Back Better would get us there. In the absence of federal action, then the thought is, well, what can the state do to move in that direction so families are not paying more than that 7%? As we do that, it's going to help. I can see Deborah Fitzpatrick from CDF going to jump in.
Well, I just wanted to mention that these are questions that are kind of core to the Great Start Task Force's work as well, and thinking through kind of how are we building a new system that makes sense for families, providers, works financially, gets us to, works for the workforce, et cetera. So big questions, important questions, lots of complications with various funding sources, some of which are identified in that question, but others as well. So that is definitely a core piece of that work.
Can I jump in as well? I wanted to speak to Sarah's first question about the legal non-licensed providers in Minnesota. This is a type of license for family members or community members that we see within the Family, Friend, and Neighbor network. So you can access some of the Child Care Assistance Program, CCAP reimbursement, if you are legally non-licensed. There are a number of different criteria in place that make it somewhat challenging for people, or they're just not very interested in doing all that work to get the reimbursement. So there's a number of reasons why people may or may not do this. However, in 2021, during the special session, the legislature did provide resources along with the administration putting some federal emergency funds to support family, friends, and neighbor care. This is a challenging space to provide support because many people who provide care, the family, friend, and neighbors, often don't know they're in a field called family, friend, and neighbor care. It's a grandparent who chooses to stop working so that their daughter or son can work and gain employment for their family. Or it's a neighbor who is adding an additional child into their home because they were able to stay at home. So a lot of people don't see this as a field, but the legislature did put some resources to provide supports, such as education, access to educational materials, which are really important things to bring forward to families. But the more people that know about this, the more likely we are to get supports to those who are actually offering these services to families. So we are happy to, our email was available. We're happy to connect you to some of these state resources if you're not aware of them already.
Thank you. You know, there's a question from Mark. I'm sorry, I can't say your last name right now, but it's about parent literacy and the importance and potential for doctors' offices to help promote parent literacy. But I wondered, does I wonder, Jeff Bauer, do you want to take that one?
I certainly can try. I mean, this is something that we have talked a lot about at the chapter, and I think it's probably Dr. Nupin's question. He's been a real advocate on this issue within our chapter around parent literacy and the importance of that. And, working everywhere, with programs like Reach Out and Read and things like that in the primary care setting, and see what our pediatricians can do to promote that literacy, and especially like health literacy, right, when it comes to their children coming into the office. So it's something that we're actively working on. I think it falls under our anti-racism and disparities work group right now to be working on that. And I'd imagine there'll be a lot of crossover with the new early childhood work group as well. So it's something we're thinking and caring a lot about, and are excited to report back on in future meetings. Thank you, Dr. Nupin, if that's you with that question or comment.
I think that's correct. There are such rich questions in this, both I think chat and Q&A, but I want to make sure that we don't lose track in this remaining minutes that we have together, that if there are additional questions, Representative Pinto and Representative Damath, I think we'll try to get answers for those and get them posted that would go up with the forum publication when we get that out. So here's a question. If structured carefully, tax breaks for childcare providers might be a more efficient, less expensive and systemic way to address both childcare rates and expenses for families. And also, again, if structured well, address the rate of pay for childcare workers and underfunding of scholarships. That's a comment and a question in a way. Is somebody want to tackle that? Or is that something for a future meeting?
Well, I can maybe, I'll just note, I'll be interested, and please feel free to reach out about that. I'm not sure if it's just, it's really a subsidy for providers in general of just, if you provide childcare, you get a subsidy in the form of a tax credit. I'm not sure why that's necessarily more efficient and more effective than, so what we have happening right now are the stabilization payments providers that are receiving every month. 70% of the funding has to go to the workers. Obviously, family child care, you just keep it because you're the worker. But if it's a center, then 70% goes to the workers. I'm not sure that that's doing it through the tax code would be any more efficient or effective than simply having that check go out once a month and saying that then 70% then has to be passed on in the form of wages. I will note that if you want to subsidize care and learning based on income for families, then under Build Back Better, the structure is such that providers actually would get funding directly based on the income of the families that they work with. You can imagine that sort of gets complicated or challenging. You have to figure that out, and maybe there is an argument to say that subsidy for the families would go through a tax credit. But I'm not so sure. I guess I have to understand better the argument for why with providers you do that, except for there are some proposals kind of on the edges, you get $500 here, or in the course of a year, $1,000. Boy, with the economics of doing this work, and again, compare it to K-12, it just doesn't work. But those are, I'm certainly happy to continue to talk about that idea.
I was just going to add, I mean, I think I don't know that it would be more efficient way to do it. I think the legislature, we end up, whether it's better or worse, we end up with different proposals that try to take, some nicks out of the problem in different ways. And sometimes one way is more feasible than another. So I think it's important to look at all the possibilities for solutions. I don't think that alone is going to make a child care provider tax credit is going to make the main difference between someone being able to say, yeah, I'm making a living wage or not, but I think it's a possibility that we need to keep considering and see if there's a way that could be part of the solution. I think as Representative Pinto has mentioned, it's an underfunded system, and we need to find more ways to bring more funding in to make sure that people are adequately compensated. So thanks.
I just wanted to lift up, this isn't, I think more common than tax credits for childcare providers are tax credits for families. And there is an MCCA proposal around tax credits for providers that are getting education. So that's been a proposal that I think the Minnesota Child Care Association has advocated for. But I did want to talk to the tax credits for families piece. Earlier in my presentation, I mentioned, the working family credit, the child, federal child tax credit. One, significant use of the child tax credit was to help cover childcare costs. I also just wanted to acknowledge that, there are in other kind of tax credit spaces a lot of attention to how do we make those work better for especially low-income families that can't wait until the end of the year to receive that support. If you think about putting out $12,000 for childcare and then getting, a couple thousand back at the end of the year. I think there are just some creative approaches, again, learning from the CTC about how we could think about those existing tax credits to, in ways to make them more friendly, especially and helpful to particularly low-income families that can't wait until the end of the year to receive support. So I think there's a lot of opportunities there on that side of the equation.
We are right at 10:40, and I want to just take this opportunity to thank you all and to say that we have a couple slides we want to talk about because we have some other announcements we want to make. But in the questions and the comments that have come in from both the chat and the Q&A are just so rich that we will work our way through them and work to get answers out, and also use your good thoughts and the work that's going on right now to build into our next forums. And we just really want to say a big thank you to all of you for your work. And so we have a couple of slides now that I want to just highlight that were referenced earlier. One is from Dean Hong, that St. Thomas has a new Minnesota Institute for Trauma-Informed Education. And I don't think Dean Hong is still on, but I'm not totally sure.
She is not.
She is not. All right. So I just want you to be aware. And then the next slide, please, is that I just want to note that the Early Risers podcasts are entering a new season. And I think yesterday was the final episode of the season 2. And it features a conversation with Dr. Damian Fair about early brain development. And you can check out the Early Risers at mpr.org. You'll see there. But again, I just want to call that out as a wonderful resource that has come from Little Moments Count and Diane Halsey, who is at Think Small. And then the next slide. This is an event that Mai Kao Hong is speaking at with Megan Gunner and Andrea Walsh, and that's in February 2nd with the Itasca Project. And then the next slide, we have a House hearing, and I'm going to turn it over now to Representative Pinto and Representative Dameth to wrap us up.
Thank you, Jane. Yeah, and I'll just note this hearing coming up is something for folks to keep an eye out for. The hearing itself will be on the University of Minnesota campus, but it'll be broadcast, of course. And so we just want to highlight this. Maybe I'll let my co-host, Representative Dameth, if there's anything you want to say, and I'll wrap up, and then we'll be all done.
Thank you, Chair Pinto. Again, thank you for those attending and watching this forum this morning. I think the information is very important. The Prenatal to 3 forum, knowing that the intent is to share plans, to build knowledge, and to build relationships. I believe that took place here and will continue to. The ideas and the topics that were brought forward and the challenges present a lot of opportunity. We may come at different perspectives of how to reach the goal, but I believe the true goal is how can we best serve our littlest Minnesotans, to serve our children. We need to keep that in the forefront of our mind and find creative and sustainable ways of doing that. So thank you to all that attended this morning, and thank you, Chair Pinto.
Thank you so much. Thanks to all. Actually, good point. I forgot we did have another save the date. So thanks for bringing this up, which is the next one will be in April. Just a reminder to folks, these started in the summer of 2016. And for a long time, the late Senator Ralph was a co-host. I've been so glad to have Representative Dameth joining for these. And I guess I just want to encourage everyone as the legislative session starts next Monday, January 31st, be in touch with us and be in touch with your own legislators. Folks may sort of think of them as being distant people. They live in your neighborhood. Know who your representative is, know who your senator is, be in touch with them about the issues that are important to you, certainly the issues relating to prenatal to 3, and let them know what's going on. And as you have ideas and thoughts, feel free to reach out to us as well. It's absolutely important that we have everybody involved in our policymaking, especially for those of you who are advocating in this space. That feels especially important and necessary at this critical time for our state and for our country. So I'm so thrilled. I just want to also thank the University of St. Thomas for the support that you've provided. It's been a great partnership. And to Jane Kretzman and to the Elders for Infants for their partnership and their support of these forums. And to Jane for very nimbly handling all sorts of things over the course of the last hour and 45 minutes. You've been just terrific, and so grateful to you and to all of our presenters. Thanks so much to all. I think, Jane, I think we are all done. Is that correct? I can see it looks like you're muted.
I'm waving goodbye because I think we are finished. And I really appreciate everybody's time and talents. So stay warm.
Thanks all. Take care.